Dear students, today we are going to see on a new topic called mushroom poisoning. Mushroom poisoning, if you saw about a lot of history has been talking about mushroom poisoning. From AD 54, mushroom poisoning has been documented and has been used for various type of criminal activities or to nullify peoples. Even in Indian um, history also, there are some mushrooms has been indicated in Hindu Vedas, like Amanita muscaria to visualize the gods, improve the spiritual vitality. Such things has been mentioned in 1500 to 1200 BC. So uh, if you go through the history of this mushroom poisoning or poisonous things in the mushroom, there are a lot of history has been talking about this mushroom poisoning, like English history, Roman history, and psilocybin, and even you could see Japan as the first country was started uh, to cultivate, or they started this cultivation of uh, mushrooms in commercial spaces. If you see, you can see Russian history, and European history, and English history. So, like that, it will go on. So, our concentration is mainly on different type of mushroom toxins, and how we can treat such mushroom toxins. So first we will go to the group 1 compound of mushroom toxin called amatoxins. So they are the most difficult one to treat. 90% of the all death due to mushroom, most of the death happens with the mushroom poisoning is mainly happens or mainly due to amatoxins. So you can see the species. What are the species which can produce these toxins are Amanita phallodilsa, Amanita aureata. So such type of fishes are very containing this amatoxins toxin. And the thing is, the toxin amatoxin is stable to cooking, heat, malleable, pickling, salting, and they are not able to hydrolyze by digestion, and also they can be reabsorbed back in your kidney distant tubules by normal your distant tubule can reabsorb back the undigested, undamaged, or non-digested hydrolyzed toxins in the kidney. So what is the mechanism is they mainly inhibit the RNA polymerase II reaction. So it is slow poisoning. So slowly it started poisoning, and we can say it is 10 times more potent, lethal than cyanide. Even though they are 10 times more lethal than cyanide, but thing is very difficult, not easily absorbed from the digestive system after ingestion. So they inhibit RNA polymerase, so interfere the RNA transcription, which is resulting a slow lingering. So we can see what are the stages of this amatoxins poisoning. So you can see phase 1, a latency or lag period of 10 to 12 hours after injection. So it will not produce any immediate effect after the injection of mushroom. So after it will take 12 to 10 hours. So why this much hours? While the toxins are absorbed through the digestive system, being attacked liver. Suppose the toxins are very rarely absorbed, very difficult to get absorbed from your gastrointestinal tract. Even if it is absorbed, so it from the digestive tract, it attacks first the kidney and the liver. So in the phase 2 reaction, you can see the onset of symptoms. What are the onset of symptoms in the phase 2 reaction? Is severe abdominal pain, nausea, vomiting, diarrhea, delirium, hallucination, hypoglycemia, and life-threatening dehydration. These are the phase 2 symptoms of this amatoxin toxins. Mainly gastrointestinal phase, we can say that's a gastrointestinal phase. So it is an abdominal pain because it is attacking the gastrointestinal tract, and vomiting, diarrhea, delirium, hallucination, hypoglycemia, and life-threatening dehydration can be happen in the phase 2 reaction. Phase 3 has several gastrointestinal phases, veins. So we can say in the phase 2 we can see the gastrointestinal phase or gastrointestinal symptoms which are seen in the gastrointestinal phase are veins or disappear slowly, and brief remission of symptoms after 3 to 4 days, and a small remission of these symptoms after 3 to 4 days can be happen. The jaundice set in the renal disturbance toxic hepatitis, liver damage, enlargement, and hemorrhagic of liver can be happen in the phase 3. So phase 3 gastrointestinal phase disappears slowly, sometimes 3 to 4 days brief remission can be happen, but the main thing is jaundice, renal disturbance, toxic hepatitis, liver damage, liver enlargement, and hemorrhagic of liver can be happen. So in the phase 4, death takes place within 6 to 8 days after injection. Mainly the death happen mainly is because of due to the liver as well as kidney and cardiac damage. These are the 3 damages where the death happens with this mushroom poisoning, amatoxin mushroom poisoning. So if you see the clinical effect, the delay of 6 to 12 hours before initial symptoms is common. So it will take minimum 6 to 12 hours to produce the symptoms, and if once the symptoms started, you can see a sudden onset of sharp colic abdominal pain. That is, colic means severe abdominal pain pain can be happen, followed by nausea and vomiting, thirsty. The person will feel lot of intense thirst, dehydration, bloody stool can be produces, and latent period may be lasting to 3 to 5 days. The recurrence of abdominal pain with jaundice and renal shutdown, seizure, then coma and death is the symptoms or the clinical effect of amatoxins. So toxins eliminated via a repeated dose of. How can treat these amatoxins? We can treat mainly by because as we know it will be slowly absorbed from the gastrointestinal tract. So elimination, we can go repeated dose of charcoal. It can absorb in the charcoal and be eliminated. Supportive care should be given. Fluid, because it causes severe dehydration, so fluid and electrolytes should be supplemented. And another thing is the penicillin G can display the amantine from the plasma binding sites. Suppose the amantine is absorbed and binded in the plasma to the plasma. From this plasma binding site, penicillin G can displace amantine. So 300 to 400 units can be given per kg, can be given as to displace. So the amantine will be come out to the kidney or to the bloodstreams as a free drug, and it can be eliminated faster from the body, but through dialysis or some other mechanisms. Silymarin can be given. We can from the it compete for a membrane transport, so it will prevent the reabsorption of amantine from amatoxins from the distal convoluted tubule. So it compete for the membrane transport, and also it is a liver protectant because amatoxins can produces liver damage. So it can also, the silymarin can also protect the liver. So if the liver has been damaged severely, then liver transplantation should be done. So this is the amantine phyllodosis picture. This is amantine augertia picture, and next one is group 1A Orlinia categories. So this is nearly over thousands in the Cotinarius species, over 1,000 in the USA, and causes, the main mechanism is they causes severe renal damage, resulting the decrease in GFR, glomerular filtration rate, decrease in the absorption in water, sodium, potassium, proteinuria and glucoseuria can be happen. So how they will produce this effect is they inhibit the DNA, RNA and DNA synthesis in the kidney cells. This is how the orelinin species can produces damage. So they are mainly targeted on the kidney cells. So initially a mild gastroenteritis is the symptom. So if the person is get infected or get injected to ingested this Orelinia clean toxins, mushrooms, then a mild gastroenteritis will be the initial symptom, and a long latent period. They are having a very long latent period, nearly 36 hours to 17 days is the latent period for this toxin. So the symptoms include severe thirst. So the persons will have a severe thirst. He will thirsty will be very severe. Abdominal or flank pain, chillness and fever. So abdominal pain or flank pain means above the rib area. A dull aching pain, a discomfortable pain will develop in that above the rib area. That's called flank pain, and also having chillness or fever can be developed. And this progresses to an acute renal failure, because as we know it damages the RNA DNA synthesis in the kidney cells. Acute renal failure followed by chronic failure occurs in 50% of the cases, because it have a long latent period, so it can produce a chronic toxicity also, and recovery takes weeks to months. Sometimes if you are lucky, it will be takes within weeks it will be cleared, or it will take so many months to clear from the toxins. So how you can treat this orelinanin toxins? First thing is your standard decontamination. You can go for a standard decontamination with the charcoal. Then if it is absorbed in the blood, you can go for hemodialysis. Renal transplantation you can do, and steroid, hemoperfusion and forced diuresis do not improve the outcome. So steroids will not work, hemoperfusion will not work, forced diuresis will not work. So better standard decontamination with hemodialysis. If required, if the kidney has been damaged permanently, go for renal transplantation. Next one is group 2, muscimol or ibotenic acid, or muscimol or ibotenic acid, Amanita muscaria, Amanita andrenia and Amanita gamata are the species of mushrooms which will produce this toxin. Toxin is ibotenic acid, which is metabolized to muscimol, and this muscimol acts as a false transmitter which acts on GABA receptors and affects the brain level of, so it affects the GABA receptors and controls or decrease the brain level of serotonin, dopamine, noradrenaline level, and usually results as an anticholinergic. So the clinical symptoms will be like anticholinergic symptoms, and may represent a so sometimes it may with an anticholinergic, or sometimes it may be with cholinergic symptoms, depends upon the type of poisons which has been ingested. And onset within 30 to 90 minutes, so it's having a quick onset of action, mostly marked to 2 to 3 hours. So you can see the clinical symptoms like drowsiness, confusion, resembling of like alcoholic symptoms, intoxication, dizziness, ataxia, euphoria, muscle cramps, spasm, delirium, visual disturbance, hallucination. It's almost like an alcoholic, like resembles to alcoholic effect. So it has been mostly misused by olden days for this, due to this effect of these mushrooms. And vomiting is very rare. Sometimes it may go to a deep sleep or coma and terminates the episode, usually lasts 4 to 8 hours. So the sleep or coma may be prolonged, or maybe lasted for 3, 4 to 8 hours it may last. The standard how you can treat is, you can go for a standard decontamination measures, support the airway hemodynamics with the standard measures, maintain your blood flow hemodynamics should be maintained with the standard techniques. Suppose with the life-threatening anticholinergic signs, suppose it produce any life-threatening effect or life-threatening anticholinergic effect, go with the physostigmine. That is, you can go for 5 to 2 mg slowly.